identify a 55-year-old female presented to you pain in the inguinal region. There's no swelling, nothing, right? And that pain is also intermittent. Now the clinical test is performed. I want you to identify what clinical test it is. Based upon the clinical test, I want you to identify what test did we perform. All right. So let's go into the video. Now this is that female. Now in the video, you can see one limb is straight, the other is semi-flexed, and she refuses to extend it. That's the first thing, right? Now you see that I'm going to do a couple of maneuvers. The first thing I'm going to do, I'm taking the knee and I'm going to push the knee on the other side. What is that called as? It is called as abduction of the knee, right? I've done the abduction of the knee. The patient is complaining about pain, right? Then I will do the medial rotation. Then I'll perform the medial rotation at the level of thigh. Again, there is pain. Now the third thing, I'll try to extend the limb. Again, there is pain. So pain on abduction, medial rotation, and extension of the lower limb. In which condition would you see all this, and what is this test called as? That's it. Right? So you're done abduction, you're doing an internal rotation, and then you're extending the limb, and all three maneuvers are causing pain. If all three maneuvers are causing pain, what do you think is the problem here? And the answer to this question, I know you have guessed it right. What is the answer? The answer to this question is correct. This is your Hauschip-Romberg sign, which is seen in obturator hernia. Right? So this is your Hauschip-Romberg sign, and this is what we call it as your obturator hernia.